In Manila's streets they roamed alone, till the mentor's voice gave them a home. From the islands to the globe they flare, wings of care spread everywhere. From night shifts under neon glow to dawns where new potentials grow, with stethoscopes and dreams they soar, bringing healing to distant shores. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives. In the quiet mornings they recall a guiding hand that moved them all through exams and doubts that pierced their mind. They found purpose, one of a kind. And they wear their scrubs like capes of might, stand tall in challenges day and night. From the barrio to the world at large, leading change with every charge. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives.
Welcome to the Ray A. Gapuz Review System, your gateway to success. Conveniently located in the heart of the city, we are just a stone's throw away from everything you need. Fast food for a quick bite, a nearby church for moments of reflection, and excellent transportation links to ensure your journey is as easy as possible.
Oh, hello there! Are you ready to elevate your career? My name is Vince Stylo, a registered nurse and a product of the Ray A. Gapuz Review System.
Here, I experienced top-tier review and testmanship training in a comfortable, convenient location. Imagine I learned how to use functional concepts to answer questions in the test with confidence. The Ray A. Gapuz Review System instructional method is superb. Whether you're looking for face-to-face or online review courses, they've got the right program for you. The expert instructors and flexible schedules ensure you get the training you need when you need it.
Don't wait, join us today and unlock your future.
I started just like you.
After completing my review programs here, I gained the skills and confidence I needed to step into a professional role. Now, I'm here to help you achieve the same success.
Here at the Ray A. Gapuz Review System, it's not just about learning, and it's about growth. And I am proud to be part of this journey.
Now, I'm here to help you achieve the same
makes perfect. One of the key advantages of our program is the hands-on experience that we offer. Our state-of-the-art simulation rooms lets you practice real-world scenarios in a safe environment. With advanced learning tools, you can build your skills, make mistakes, and learn from them, all before stepping into the workplace. This is how we prepare you for your success.
Here at the Ray A. Gapuz Review System, we pride ourselves on providing the best resources available. From books, learning management system, and apps, we have it all for your use. Our curated collection of textbooks and study guides are carefully created to support your learning. We invest in top-notch materials to ensure you get the most comprehensive and up-to-date information. This is how we stay ahead and help you stay ahead.
Enroll today and build the career you've always dreamed of. We're here to help you succeed.
Join us at the Ray A. Gapuz Review System and take the first step towards a brighter future. Your success starts here.
We're here to help you succeed.
The legacy of love and learning, the story of Mother Gapuz. In a quiet town in the Philippines, a resilient woman with a heart full of dreams and courage began a journey that would change countless lives across the globe. Mrs. Evangeline Gapuz, lovingly known as Mother Gapuz, was no stranger to hardship. Left a widow with her only son, Ray, she could have chosen to live a quiet life of mourning, but instead, she chose purpose. Fueled by her unwavering belief in the power of education and the strength of her faith, she co-founded the Ray A. Gapuz Review Center Riggers in 1994 with nothing but hope, humility, and 3 students in a small classroom. What started as a modest review center soon began to take root. Mother Gapuz poured her love into every detail, from welcoming students like her own children to personally preparing snacks and praying over each learner's journey. Her warmth and dedication laid the foundation for a legacy built not on numbers, but on nurturing dreams. At the heart of it all was her son, Dr. Ray A. Gapuz, whom she raised to value education, service, and integrity. Dr. Ray would go on to become a board top-notcher, a nurse entrepreneur, and a multi-awarded academic leader. But more than his accolades, what made Ray special was how he carried his mother's light and amplified it. Together, they built not just a review center, but a beacon of hope for nurses chasing global dreams. From 3 students to a global family of nurses in more than 35 countries, the Ray A. Gapuz Review System is now an international branded testament to how one woman's love can spark a movement. Today, every Rager's classroom carries the quiet strength of Mother Gapuz, and every success story echoes the values she lived by: faith, family, and fortitude. Though her partner in life, Ricardi Aspires Gapuz, has passed, his name lives on in every graduate who proudly says, "I'm a Ray Gapuz baby." And at the heart of it all is a mother, a widow, a warrior. Mrs. Evangeline Gapuz, the matriarch of dreams and the heart of a legacy that continues to inspire generations. Our speaker holds a higher education teaching certificate from the Derek Bach Center for Teaching and Learning at Harvard Graduate School of Education, where he also obtained a training certificate in online facilitation. He is a member of Harvard Business Review Advisory Council, an opt-in research community of business professionals. He finished his Master of Education in Learning, Design, and Technology and Post-Baccalaureate Certificate in E-Learning Design at the Pennsylvania State University, where he finished both courses with a GPA of 4.00. He completed his training on the ecosystem approach to designing and implementing outcomes-based education from the ASEAN University Network in Thailand. He finished his Bachelor of Science in Nursing cum laude and Master of Arts in Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating 89.20. He is a recipient of two doctorate degrees honoris causa from two state universities in the country, the Ramon Magsaysay Technological University and the Pangasinan State University. He co-authored a book on technology integration in teaching and learning entitled Collaborative Virtual Instructional Designs for Teaching and Learning Nursing. He is the author of Nclex RN in a Flash published by Jones and Bartlett, USA, and Mosby's Essential Concepts for the Philippine Nurse Licensure exam published by Mosby Elsevier. He is the proponent of the Functional Concepts method, a teaching pedagogy for international licensure exams. He is the inventor of several game-based apps and a consultant of various international firms and educational institutions. He is a multi-awarded entrepreneur and author. Among his numerous awards are the Manny V. Pangilinan MVP Bossing Award for Education, the SME-IT Award for Innovation from the Philippine Internet Commerce Society, the AGRA Award for Entrepreneurship from the Philippine Marketing Association, the 10 Outstanding Filipino Entrepreneurs Entrepreneur 10 from Entrepreneur Magazine, and the Young Market Master for Entrepreneurship from Mansmith and Fielders. He is also the first Filipino nurse entrepreneur to be accepted as part of the Ernst and Young Entrepreneur of the Year Academy. In 2005, he was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs, and in 2006, the Philippine Graphics magazine's Young Leaders of the Philippines. Also in 2006, he was co-listed with Bill Gates in the 25th edition of Marquis Who's Who in the World. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship PCE, an advocacy group under the Office of the President. Ladies and gentlemen, Dr. Ray A. Gapuz. Currently, he serves as a trustee of the
Good evening, USRNs to be. This is your mentor, your fact check buddy, Ray Gapuz, joining you in this teaching and learning session. And there's a lot that's in store for all of us tonight. And let me first acknowledge where you are. Could you please type your location? Where are you in the world? Okay, I'm joining you here from my humble abode in Alabang, Muntinlupa. Where are you? So I'm here in the Philippines. Right now, I'm in the Philippines. Okay. So we have someone from Nigeria, from Caloocan City. We also have from, let me pronounce that foreign sounding, Imus, Cavite, Philippines. From Kingdom of Saudi Arabia, from Ghana, wow. We also have someone from Cebu, from Singapore, from Cainta, Rizal, Ilocos Norte, ay nanay, bag nga rabiyo amin kadagita apo. Saudi Arabia, Kenya, hindi sa akin, hindi sa'yo, ito ay Kenya. Okay, Davao, Tugigaraw. Somebody is coming, joining us from Canada. Welcome, welcome, and welcome everyone. Somebody is joining us from Batangas, Isabela. Thank you very much for deciding to spend at least a moment of your time over the weekend in order for you to, hello from Valenzuela. I thought it was Venezuela. Wag isuko ang Bataan. So tonight, I'll be joined by two of our senior mentors, our Vice President for Research and Program Development, Mentor Che. Say hi to everyone, please.
Hi, everybody.
Okay, and where are you joining us from, Mentor Che?
From Laguna.
Okay, Julita is joining us from the Gupan City, and someone is joining us from Ubando, Bulacan. Nilulubog na sa Sabah. We'll pray for you. Keep yourself dry, and please put your laptop on the second floor of your house if you're doing that. Let's also welcome our lead mentor for the 85ers Elite Club, those who pass the MGN with a minimum number of items of 85. Could you please welcome Mentor McLean? Say
Hello,
hi, Mentor McLean.
everyone.
And you are joining us from where?
I am joining you from La Union.
Okay, Nema. Charot-charot ka, McLean. Nema Grace is joining us from Bacolod City. So we have a bevy of participants from all over the world. And I'm not going to keep you waiting that long. Let me begin with this thing. What has change. Something new that you should know. There's something new within me. Ganon. Or Batang 90s, the theme song should be, I guess I wanted something new in my life. Yee! A new key to fit the new door. Ganon? Okay. Anyway, let's keep the ball rolling. What are the things that you should know? Because these concepts are trending now on the test in one way or another, and you might not have given it enough time for you to decipher which concepts you need to know, or shall I say, you must know. Okay. Well, Kadahin Geraldine says, singer pala kayo, sir. Of course. I used to have, when I was younger, I used to have an album, and the Carrier single became the most requested song sa FM radio that was written by the great Vinny Saturno. O, di ba? Huwag na natin pag-usapan yung past life ko. Let's talk about these new things that you should know. Okay, so isang kanta pa daw. You want me to sing? Well, you have to send 500 for a cappella to my GCash. And if you want to have it, to hear the song with accompaniment, it has to be 1,000 pesos. Of course, I'm just kidding. Okay, this is not about me, colleagues. This is about your dream. You want to be in America, and the only way to be in America and work there as a nurse is to pass the next generation Nclex RN. Bernadette says 5 pesos lang daw yung kaya nila. So they can only pay me 5 pesos. That would be all right. Kahit walang bayad, libre na lang. Okay, so let's begin with the first one. Okay, here we go. Mr. Rosenthal, 28-year-old male, presents to the outpatient clinic with complaints of persistent low back pain and stiffness that has been going on for the past 8 months. He reports that the pain is worse in the morning after prolonged periods of rest, but improves with exercise. It usually lasts an hour or more. Okay. He also notes fatigue and occasional pain in both buttocks. On physical examination, there's reduced spinal flexion and tenderness over the sacroiliac joints. He denies any recent trauma or infection. A family history reveals that his father was diagnosed with a spine problem in his 30s. An X-ray of the spine reveals sacroiliitis and the early signs of vertebral fusion. Okay? Suggestive of a bamboo spine appearance. Don't get ahead of me. First, listen. What is the most significant data here? Answer that. You just don't give me an answer because it feels like it's the answer. Gaga. Okay. What is the most significant data? Tell me. Is it the symptoms? The group of symptoms? Would it be the age? Could it be the genetic predisposition? Okay. Or could it be the gender? What do you think? The genetic predisposition. If you're going to get through all of this, osteoarthritis, enthesitis-related arthritis, ankylosing spondylitis, rheumatoid arthritis, all of this involves a certain degree of inflammatory reaction, and all of these have genetic basis. Sorry to say. Okay. Listen. Which of these are you not familiar with? Is it osteoarthritis, enthesitis-related arthritis, ankylosing spondylitis, or rheumatoid arthritis? Which one are you not familiar? I want you to be honest. Please do communicate with me through our chat box. Which of these are you not familiar with? Okay, 3, 2, 2, and 3, ERA. Okay. There are things that you're not familiar with, and yet you are giving me an answer right away. Mga gaga ito. Okay, this is how you eliminate the other distractors from this specific condition. Okay, first and foremost, note that the patient has morning stiffness. Morning stiffness is usually very characteristic of rheumatoid arthritis, ankylosing spondylitis, enthesitis-related arthritis, but less of osteoarthritis. You have stiffness in osteoarthritis, however, it's not as significant as in the other types of arthritis. And take note, usually your osteoarthritis affects your weight-bearing joints. And this is caused by the most common risk factor, the number one risk factor, obesity. That could potentially lead to the degeneration of the joints, leading to the characteristic grating sound that you will hear, and that's going to be your crepitus, plus your Heberden's nodes and Bouchard's nodes. So we eliminate osteoarthritis. Next, pay particular attention to the affectation in the area of the sacroiliac joints. Usually, rheumatoid arthritis affects the joints of the upper extremities, the fingers, the wrists, the elbows, to a lesser extent, the knees, the ankles, and the toes. So, not the sacroiliac joints. We eliminate now osteo and rheumatoid. You're left with two. Come on. How do we analyze which is which? Okay, listen. Both your ERA, that's your enthesitis-related arthritis, and your ankylosing spondylitis affects the joints. Okay. Now, enthesis is actually the part of the joint in which your tendon and ligament attaches to the bone. I'll show you the picture later. Ankylosing spondylitis, on the other hand, is primarily an inflammatory condition with genetic basis related to HLA-B27, the presence of that gene, and this could lead to inflammatory reactions in the spine that could potentially lead to inflammation and then eventual degeneration of the joints and resulting fusion, making now the spine a little more rigid and inflexible. Now, let me tell you about this, and you have to know this. Enthesitis-related arthritis is a subtype of juvenile rheumatoid arthritis. And let me also tell you about the fact that enthesitis also occurs in ankylosing spondylitis. However, that's why I asked you which of these is the most significant data. It's actually the onset. Enthesitis-related arthritis can have almost the same symptoms as that of ankylosing spondylitis. However, enthesitis-related arthritis affects children and adolescents, whereas ankylosing spondylitis affects adults, okay, in their 20s up to under 40 years of age. Therefore, the most significant data here that will let you differentiate the two most plausible answer could be, look at the age of the patient. That breaks the tie. And the answer is, that's your ankylosing spondylitis. Okay, way to go. Class, tell me, are you learning? Yes or no? Are you learning? Yes or no? Is this the way you are studying these concepts? If this is not the way how this is being taught to you, stop attending those types of classes where people are just teaching you NLE type of questions sa kababawan. Okay? Very superficial stuff. Okay? And most of them usually are not yet Nclex, RN passers, and the nerve to teach Nclex and GN. Okay? So always remember, your mentors should be seasoned mentors with international experience. And you can only find these mentors who are highly qualified at the Gapuz system. The only one where you can have the opportunity to use the only NGN simulator in the world. It's at the Gapuz building in United Nations Avenue. Okay? So let's move on. Are you ready for more? Okay? Are you ready for more? Yes or no? Tell me, are you ready for more? Okay, so let's have some more. Okay. Okay, you're ready for more? So let's do some more. This time around, let me show you where your enthesis is. Okay, this is where your ligament and your tendon gets attached to the bone. Okay, that's your tendon. Okay. Then you have, this is your cartilage. Okay. So this is the bone. Okay. So your tendon and your ligaments gets attached to the bone, and this part is known as your emphysis. Okay. So let's move on. Now, here we go. A nurse is reviewing the effects of misoprostol on pregnant clients. Which of the following are possible effects of cytotec when administered during pregnancy? Select all that apply. Look, this question is not asking about side effects. It's asking about the effects. Okay, what is the key? You have to know what is the primary indication of misoprostol or cytotec. Okay, not the off-label effect, but the indication. Okay, now pay particular attention to the fact that your misoprostol can be used in clients with peptic ulcer disease. However, it is also used in order to jumpstart labor in clients. Okay, so as such, what does it do? First, it effaces the cervix. What does that mean? Well, it thins the cervix. It promotes cervical ripening. And with that, it also helps to dilate the cervix, eventually jump-starting labor by acting as uterotonic, meaning it stimulates uterine contraction. So in essence, can we use it therefore to prevent postpartum hemorrhage? Definitely yes. But what is the danger? What is the danger? The danger is you try to assess if the client has taken uterotonic herbal remedies, like for example, blue cohosh, or uterotonic drugs like oxytocin, because the combined synergistic effects of these interventions could potentially lead to uterine rupture because of prolonged uterine contraction. Therefore, okay, let's go back to the question. Which of the following are possible effects of cytotec when administered during pregnancy? Uterine contractions, yes, we talk about that. Okay. Cervical ripening, yes, it thins the cervix, eventually dilates it. Okay. Prevention of postpartum hemorrhage, yes, because it's a uterotonic. Increased risk of uterine rupture, yes, especially if the client has taken blue cohosh or if the client has been given oxytocin. Now, however, does it cause acceleration of fetal heart rate? Actually, it causes the reverse. It causes deceleration or slowing of the fetal heart rate. So this is an X, and it doesn't have an effect on lactation. So the answers, therefore, are 1, 2, 3, and 4. Let me ask you this question. Have you been studying misoprostol lately? Yes or no? Have you been studying misoprostol lately? I'd like to see. Yes or no? Okay. However, what are you studying? It's cytotec-induced fever. And I'd like to share with you, colleagues, that since that is also a trend, please subscribe to our YouTube channel because I'm uploading every week, and you have your cytotec-induced fever. You have a sample case study that I analyzed for you. So if you want to dig deep into cytotec or misoprostol, please subscribe to our YouTube channel. We now have more than 27,000 subscribers. And of course, number one is Madame Flor Villarrier, the world's oldest next generation Nclex passer. Okay, so let's move on and try to do some more of these. Okay, here we go. Are you learning so far, colleagues? So far, yes? You want some more? You want more? Okay, yeah, we're here until 12 midnight. Gaga. Okay, so let's go back to our discussion then. Okay, so let's move on. Okay, here we go. This is a very basic question. Which of the following drug administrations is incorrect? So the key word here is the word incorrect. Okay, so since each option is independent of each other, this is what I call the 4-in-1 question. Why? Each option covers a specific concept. So if you don't have a broad and deep knowledge of how things are done, you won't be able to answer these questions. Let's begin. An obese, okay, face the mirror, please. An obese adult receiving insulin is administered the injection using a gauge 25 1-inch needle at a 90-degree angle into abdominal subcutaneous tissue. Take note, even if this is subcutaneous administration, the correct angle now is 90 degrees, especially if you have an obese client. Whether this is insulin or heparin, it has to be given at 90-degree angle. This is correct. We are looking for something incorrect, okay? A newborn is given vitamin K via 25 gauge 5-inch needle at a 90-degree angle into the vastus lateralis. Vastus lateralis is actually the site of choice. Rectus femoris is the alternative site. It's also given at 90-degree angle and it's at 5/8-inch gauge 25, correct. Now, a couple of months back, like a year ago, okay, there has been an alternative to vitamin K injection, and it's given orally in 3 doses. The first dose within the first 24 hours, the second dose within the first week, and the third dose within the first month from the child's birth. However, it has been found that the oral vitamin K is not as effective as the injectable vitamin K in preventing bleeding in newborn. That's why they reverted back to recommending your injectable vitamin K. Okay? Okay. So number 2 is correct. Let's try to analyze number 3. Chester is saying, okay, I'm wrong. Maybe you weren't able to analyze it properly. So if you cannot analyze, you oralize. Okay, let's try to analyze option number 3. An adult prescribed with desmopressin. Now, pay particular attention to the fact that desmopressin is actually given in clients with diabetes insipidus. For what purpose? Okay, it decreases the frequency of urination. Okay, so in essence, it helps promote the concentration of urine in the bladder. So it has the eventual effect of increasing the urine-specific gravity and decreasing frequency of urination. That's why it's also given in clients with nocturia. Okay, now next question is, how is desmopressin given? Okay, the client is instructed to inhale the medication deeply through the mouth using a metered dose inhaler. It's not given through the mouth. Your desmopressin is given intranasally as a spray or as a drop. Okay, and you have to use 1 nostril at a time when you administer it. And since this is regularly given to the client, eventually a common side effect is nasal mucosal irritation. Pay particular attention to that side effect. Nasal mucosal irritation is a side effect of desmopressin. And what we need to check if your patient's taking desmopressin, the specific gravity of the urine, which will increase, and the frequency of urination, which will decrease. Those 2 are positive indicators of the effects of desmopressin. Now let's move on to number 4. A teenager with asthma is taught to use a metered dose inhaler by holding breath for 10 seconds after pressing on the canister. This is also correct. Now pay particular attention to the fact that if you're using a metered dose inhaler, it's best to use a spacer in order to prevent oral candidiasis, which is manifested by the presence of curd-like deposits in the mucosal lining of the mouth. And that is not normal. You can implement the swish and spit method in order to prevent oral candidiasis. So out of the 4 options that we've analyzed, the incorrect method of drug administration, therefore, excellent Junarlene, excellent GV, excellent RL. That is option number 3. An adult prescribed with desmopressin is instructed to inhale the medication deeply through the mouth using a metered dose inhaler. That is not done. Notice, colleagues, 3 and 4, numbers 3 and 4, both options contain the phrase metered dose inhaler. Now, sometimes if you want to be a little more scientific guesser, so always remember a principle in test taking. A correct answer may contain phrases that makes the options almost similar but opposite of each other. So I know what you're thinking. Sometimes you are narrowing down the answers to the last two, and then eventually you've chosen the wrong one. That happens to us, right? Especially in your choice of your spouse, husband or wife. You're down to the last two options and you've chosen the wrong one. And then eventually you get to realize there's no turning back. Okay? I just hope you don't do that when you're trying to choose answers on the next generation Nclex RN. And RL is saying here, nakakatawa po, first time nyo na-mention name ko, Doc. Okay. Yes, of course. Okay, that's one of my favorite brands, RL, Ralph Lauren, Isocial. Okay, so the answer is number 3. Excellent. Okay, so at this point, okay, let me just show some principles in terms of administering nasal medications. You have to tilt the head of the patient back, insert the dropper or spray or aerosol tip into the nostril, pointed towards the eyes, apply prescribed number of drops or sprays in each nostril. And then breathing should be through the mouth to avoid sniffing medication into the sinuses. So ask the client to breathe through the mouth while you instill your nasal medications. And this is your desmopressin nasal solution. So to give it, prime the spray pump before the first use at least 4 times. And again, if unused for over a week, blow the nose gently to clear the nasal passages. Tilt the head back slightly, insert the nozzle into one nostril and close the other nostril with a finger. Okay, you can press on it. Spray once while gently inhaling through the nose. Hold breath briefly, then exhale slowly through the mouth. Once again, exhale through the mouth. Do not blow your nose immediately afterward. Wipe the nozzle clean and replace the cup. Discard the bottle after 50 sprays of your desmopressin acetate, or okay, after 25 if you're using desmopressin high dose. Once again, this drug is FDA approved also for clients with nocturnal polyuria. So far, class, how do you like the approach? Okay, is it something beneficial on your end as you are preparing for the NGN? Tell me yes or no. I love it, says Chester. Of course, thank you very much. Okay, we're actually using the functional concepts method and the think first strategy that's only learned through the Ray A Gapuz system. That's what makes our system unique. We have a registered set and trademark strategies that should never be used by anyone who is not trained to implement functional concepts method. Okay, so thank you very much, Karinthi. Thank you very much, Josephine and Quinter. Thank you very much, Naomi. Now, let's move on. And for more discussions, let us please do welcome the most beautiful 85er, Mentor McLean. Mentor McLean, how are you? Okay,
Hello everyone. Ayan. So,
would you want to open? Wow. Okay, show us your beautiful face, especially your very pronounced nose. Very appropriate for my last topic, which is the use of this
desmopressin
nasal solution. This has been a trend lately, Ms. McLean. A lot of questions on how do you administer drugs, and if you are not familiar with these drugs, because some of these people who are pretending to be Nclex RN mentors are not teaching the right set of concepts. They were just teaching pharmacology that are so basic. Maybe they're just teaching biogesic and discharge instruction as ingat, ganon, or be careful. Be safe. That's not the way to do it. If you want NGN concepts, dig deep into it. And I know Mentor McLean is an expert for digging deep. Okay?
bakit parang iba, sir? I think that's different.
Expert of deep throat. Gaga. Okay, let's welcome Mentor McLean. Go,
Hi
Mentor
everyone.
McLean.
So let's change how we present. So for tonight, so I'll be just sharing you 5 questions in terms of updates for drugs. But with that, I'll be using a Microsoft Word to which I will just type updates. And I wish you would learn from my session. So just give me a minute so I could share my screen. Saan na ba yun? Okay. So I hope you are seeing my screen as I speak. Saan na ba yun? Okay. So are you seeing my screen? Please say yes. You have no other option but just say yes, okay? Okay. So I hope you are learning, especially from Dr. Ray. So I am also learning from his session. So I just also learned a while ago your ankylosing spondylitis and your ERA. Yeah, so I also learned from him. So let's go over and talk about our NGN drugs. Okay, so let's go over with this one. So a client with treatment-resistant schizophrenia has been prescribed your clozapine. So take note, your clozapine is technically a second-generation antipsychotic. And typically, for patients taking in clozapine, you have to watch out for agranulocytosis. So how would you know if a patient would experience agranulocytosis? So basically, by checking on their labs. So primarily, before they are asked to take clozapine, you have to check their absolute neutrophil count, okay? So the nurse reinforces teaching regarding required laboratory monitoring. So how often should the nurse expect the client about absolute neutrophil count to be monitored after 12 months of therapy without neutropenia? So take note. So for example, if you have just read this a couple of years back, so technically your answer here would be either once a month or every other week or once a week. So take note, my dear colleagues. Especially this is a tricky question because there is the element of time. So the question is asking when or how often should you monitor the absolute neutrophil counts if the patient's already been taking your clozapine for a year. Okay, so that's a little bit tricky, right? So let me know, what is your answer if the question is asking about how often would you check if the patient is already taking it for a year? Let's see. If you know the answer, let me know your answer on the chat box. O ayan, walang sumagot. Ibig sabihin, hindi alam. Gaga. Bakit walang sumasagot? O lahat sila, oo. Is it one or three? Gaga, ano to? Lahat
You
may
are right,
question mark.
Miss Maclay. What they know is just once a week. You see, they don't know how to analyze. They just know how to oralize.
Correct, sir. So remember, my dear colleagues, take note, as I see through your response, your answers would have question marks. So in short, you don't know what's the correct answer. And that's completely fine. Okay? So take note. So remember, if, for example, if the patient is taking it, okay, from 6 months to 12 months, so technically, the correct answer, if it's from 6 months to 12 months, the answer would be every other week. Okay? If it's less than 6 months, okay, less than 6 months, so remember, every other week is for 6 to 12 months. Once a week is typically for patients taking it less than 6 months. Okay. Then, only before starting the medication, technically prior to giving your medications, you have to check the absolute neutrophil count. So this will be eliminated. So therefore, you are only left with one answer. And your answer here is, what's your answer? Number 1. So take note, for patients taking in clozapine for more than a year, you are required to check the absolute neutrophil count once a month. Di ba? Ayan. So the answer here is letter.
Wow, that is really an update.
Yes. So even, sir, no,
That
when I
is
also
really an
studying for the
update.
Nclex, no, I was only taught, like when you have taught this topic, actually, you always mention this one every other week for 6 to 12 months. But of course, if you go beyond 12 months, really it's once a month. So I hope everyone is learning. Ayan. O, diba? Okay, so let's go over now with the next one. So I hope you have.
RL is saying wow. They're saying wow, Miss McLean.
See? So if, for
They
example,
just
you are
learned it
joining
from
free trial
us,
classes.
85er mentors.
So imagine if you're just only joining free trial classes and they just don't know how to discuss this, then definitely in Filipino, you would say, Ngangay. Ngangay tayo dyan. Correct? Let's go over with the question number 2. So a client receiving high-dose haloperidol develops sudden high fever, muscle rigidity, altered mental status, and autonomic instability. So take note, in this question, you are given sets of signs and symptoms. So, before answering the question, so which of the following medication should the nurse anticipate administering as part of the treatment plan? So the first thing you need to know is to identify what is your working diagnosis. So take note, haloperidol is an antipsychotic, correct? So that's your first generation. And usually, take note, first generation antipsychotic, usually if you would see high fever and muscle rigidity, you are led to answer neuroleptic malignant syndrome. Take note of that. So the moment you see high fever, muscle rigidity, and the patient is taking in antipsychotic, that is your neuroleptic malignant syndrome. However, if for example, if the question here would say the patient is taking in an antidepressant, okay, for example, SSRI, your Prozac, Zoloft, and if the patient would develop high fever and muscle rigidity, that's not neuroleptic malignant syndrome. That is your serotonin toxicity. So take note, they somehow share, there would be an interlapping sets of signs and symptoms, but the key to differentiate the two is that you need to check what type of medication is the patient taking. So in this situation, the patient is taking in haloperidol. So suspect that the patient might have neuroleptic malignant syndrome. Correct? Okay. So take note, the patient is taking an antipsychotic. Okay. So let's go over. So which of the following medications should the nurse anticipate as part of the treatment plan? So remember, select all that apply. So remember, number 3 is already eliminated. Why? Why do you give, why for patients developing neuroleptic malignant syndrome, the first thing that you need to do is to stop the medication that causes the problem. So eliminate haloperidol. So therefore, now you are now then led to 1, 2, 4, and 5. But let's go over. Okay, let's go over with your dantrolene. So take note, your dantrolene is a muscle relaxant. So take note, the patient is developing muscle rigidity. So it's appropriate for us to give your dantrolene sodium. So this is a muscle relaxant. Yeah. Okay, so take note, eventually it would address your fever and muscle rigidity. So we include this one. Okay, next. Bromocriptine. Okay, remember your bromocriptine is a dopamine agonist. So it would counteract your dopamine receptors, blockade caused by your antipsychotic. So usually, bromocriptine helps reverse your neuroleptic malignant syndrome. So typically, this is also given. So 1 and 2. Gaga! Bakit may nagsagot ng number 3? Chester, why did you answer 3? Kakasabi lang, I just mentioned that you have to eliminate haloperidol because that is the offending drug. Echosera ka. Hindi pa kasi ako tapos. Echosera ka. Nangunguna ka na naman. Okay? So that's completely fine. Okay? So remember, your haloperidol should be stopped because that is the offending drug that causes your neuroleptic malignant syndrome. Next, we have your lorazepam. Remember, your haloperidol is a benzodiazepine, correct? Okay, so usually this is used for sedation, especially if patients would be, take note, usually patients with neuroleptic malignant syndromes are also agitated. So lorazepam is given. And your amantadine, so your amantadine is also a dopaminergic agent. Okay, so technically it is used as an adjunct therapy for patients with neuroleptic malignant syndrome. So especially this is given if your bromocriptine is not tolerated. So for example, if your bromocriptine is not tolerated, then you can give your amantadine. So remember, for patients with NMS, take note, remember your mnemonics BALD, no? B-A-L-D. So bromocriptine, your amantadine, your lorazepam, and we have your dantrolene. Take note of that, my dear colleagues. So you are correct, Rowena, 1, 2, 4, and 5. So haloperidol is eliminated because that is your offending drug. Okay? And so I hope everyone is learning. Ayan. So remember, this is an update really, no, in terms of your management for your neuroleptic malignant syndrome. Kasi before, what I knew as well would only be your bromocriptine and your dantrolene sodium, to be honest. So including lorazepam and amantadine, that's already an update. Okay? Next. So number 3, a nurse is caring for a pediatric patient receiving vincristine as part of your chemotherapy for leukemia. So which of the following side effect is most commonly associated with vincristine therapy? So first, you need to know what are the common medications or chemotherapeutic drugs that is used for your chemotherapy. Okay. First, we have your cyclophosphamides. Okay, so common chemotherapeutic drugs. Okay. First, we have your cyclophosphamide. Okay. Famide. Ano ba yan? Buti na lang sa... Thank God in Nclex there's no spelling bee, no? So take note your cyclophosphamide, okay? Usually common side effects of patients taking in cyclophosphamide would be your hemorrhagic cystitis. Take note of this one. Okay. Okay. Next, we have second drug common in patients taking in your chemotherapeutic drug is your cisplatin. Okay. Take note your cisplatin is typically ototoxic and nephrotoxic. Okay. So if the patient if a patient is taking in cisplatin, check for hearing impairment. So patients might complain tinnitus. For nephrotoxic, so check for renal function. And we also have your adriamycin. Okay, so adriamycin is considered cardiotoxic. Okay, so you need to monitor your ECG. And lastly, we have your vincristine. Okay, so for vincristine, it is considered neurotoxic. So how would you know if patient would experience neurotoxicity? So look for tingling sensation, numbing, and we have peripheral neuropathy. Okay? So therefore, we are left with, what's your answer, my dear colleagues? What's your answer? O, di ba? Pag sinabi sa inyo, tsaka nyo alam. That's a problem, no? And that's completely fine. Okay? So therefore, our answer here is your peripheral neuropathy. Yeah. So this is our answer. So take note, these are common chemotherapeutic drugs. We have your cyclophosphamide, cisplatin, adriamycin, vincristine. Okay. So number 4. So
Miss McLean, where is the tingling sensation in peripheral neuritis?
I think so, it's in the
Is
clitoris.
it in the labia?
That's a different story, sir.
Yes, it's in the fingers and toes. Yes. Okay. Just joking around. Sorry.
Ayan. So thank you, sir. Ayan. No, I really like Sir Reno. Yes, this is fun learning. Thank you, Rama Amado. I think Rama Amado is a foreign body because she or he is not from the Philippines. Correct me if I'm wrong. Rama, are you a foreign body or a foreigner? Let me know.
Are you
foreign
a foreign
body
that
aspiration.
sticks or that spurts? What?
Age from Ghana. Oh, so you're from Ghana.
Oh yeah, she's from Ghana. Okay, so she must be very healthy because she has a lot of
Ghana.
Okay. No, just to clarify, put everything into perspective, Ms. McLean.
Yes.
I'd like to react on your haloperidol because my internet is bad a while ago. So let me just clarify. Haloperidol is an antipsychotic, correct?
Yes,
and then it's the offending drug, just to summarize it. So you have to eliminate haloperidol. That's a strategy. And take note that lorazepam is a benzodiazepine, and it's given in order to prevent seizures also. So that's also a tip. I just would like to highlight that because that came out in the test recently. Okay.
Thank you, sir.
Okay, on to the next.
Okay, so we're down to our second to the last question. So a client is admitted with muscle pain, weakness, dark cola-colored urine, and elevated creatinine kinase level. So take note, what I like personally in the review system is that we don't give directly the diagnosis. Because with that, we are using the syndromic approach. Because in the actual exam, usually, the question would just give you the signs and symptoms. So it's up to you to analyze or even oralize what would be the working diagnosis. Yes, I really like that, really. So even some students would ask me, Ma'am, how would you identify if it's a syndrome or a symptom? Well, typically when you say syndrome, that's a set of signs and symptoms. So in this situation, so these are your syndrome. Okay. So let's go over with your number 4. So remember, muscle pain, weakness, dark colored urine, and elevated creatine kinase. And take note, okay, the healthcare provider suspects a condition involving skeletal muscle breakdown. Okay, from this point on, you are given a clue that leading to a release of myoglobin into the bloodstream. So, if I were you, which can cause acute kidney injury. So basically in here, it does just not like it does not directly give you the direct answer. But if you are in our system, you would definitely know what would be the working diagnosis. Sige nga, let's see. What would be if for example, just reading by the example, dear colleagues, what would be your working diagnosis? Oh, wala na namang nasagot. Okay, so Jevi say rhabdomyolysis with a question mark. Raina say rhabdomyo. Then we have Chris, we have your rhabdo again. Okay, so actually you are correct. Okay, but take note, Jevi, you have to make sure that you are answering it with conviction. Okay, because in the Nclex, you have to make sure that you are correct. Yan, okay. So take note, that's correct. So remember your rhabdomyolysis. So let's have, for those who do not know, let's have a little bit introduction. What is your rhabdomyolysis? So rhabdomyolysis. Okay, so take note, in your rhabdomyolysis, it's very simple, no? So take note, usually take note, if for example, if you're thinking about rhabdomyolysis, so take note that this could be, remember, skeletal muscle breakdown. It could be because of what? It could be trauma. Okay. It could be a result of prolonged immobility. Okay. Immobility. Okay. It can be also, okay, a result of your medication. Example of medication that can cause rhabdomyolysis would be your statins, like atorvastatin, okay? Statins and even some antipsychotics. Yan. Psychotics. Okay. Then it can also be a result of either heat stroke, okay, and even seizure. Yeah. So that's for your common causes of your rhabdomyolysis.
So, Miss McLean, do you think your rhabdomyolysis could occur especially in specific professions like firemen? Because they usually get exposed to a very hot environment.
Yes, sir.
Do you think that they are really at risk for rhabdomyolysis?
Yes, sir. Yes, they are at risk because one of also the risk factors for rhabdomyolysis would be extraneous exercise. So it could either be that they're also at risk in terms of their occupation. So occupation, I think, matters in terms of having rhabdomyolysis.
Yeah.
Yeah.
Okay, I agree.
Okay. So our LCAM heat exposure. Baka ibang heat exposure yan. Okay, so let's go over. So what are usually the triad of your rhabdomyolysis? So usually, common, we have your muscle pain. Okay, as you can see in the... Okay, so muscle pain is the result of your muscle breakdown. Okay. Muscle fiber breaking down. Okay. Next, we have... Okay, so usually for this one, your intervention would be assess the severity and location, and you can give prescribed pain medications and avoid further activity. So next is we have your muscle weakness. That's also in the case. Okay. So usually there is muscle weakness because the muscles are already inflamed. Yeah. So what can you do if for example, there is muscle weakness? So you can assist with mobility. And of course, you can further prevent fall and injury. Ayan. So thank goodness in the Nclex there's no spelling. Okay, and then of course we have your dark cola or dark colored, colored urine. Or sometimes we call it your cola or tea color urine. So this is already an indication that there would be your myoglobins. Okay, myoglobins in the urine. So that's your myoglobinuria. Okay. So take note. So if, for example, if patients would have dark colored urine or quality color urine, the first thing that you need to do is monitor urine output, and at the same time, you need to push IV fluids to flush the kidneys because this myoglobin can destroy your kidney. Okay? Ayan. So that's your triad for patients with rhabdomyolysis. Amniocentesis, yes. And for your diagnostics, okay, usually there would be your elevated, so you can see here, elevated creatinine kinase. So that's already an indication that there would be kidney affectation. So take note for patients, how do you call this one? Diagnosed with rhabdomyolysis. So take note, the main treatment for your rhabdomyolysis is, okay, let me just put it here. So main treatment for patients with rhabdomyolysis would include, okay, number one, hydration. Okay, so hydration is key for patients with, take note, rhabdomyolysis. So you can give your IV normal saline, and the purpose of your IV fluids is to flush out your myoglobin to protect your kidneys. So quick reminder, take note for patients with rhabdomyolysis is to stop the offending drugs, especially if they are taking in your statins. Okay, so monitor your labs such as your creatinine kinase, your potassium, and your BUN. And of course, if there would be electrolyte imbalance, treat that and watch out for acute kidney injury. Okay? So let's go over now with our choices. Let's go over ano kaya ang sagot natin. Do we administer your intravenous fluids aggressively? Yes or no? Remember what did we say? Rapid IV infusion or hydration is your priority. So include one? Yes. Do we monitor your serum potassium levels? I did mention for your electrolyte imbalance. So yes. Okay. Do we restrict? Take note, administer and then now restrict. So remember your priority is hydration. So this is incorrect. Okay, next. Alkalinize the urine with sodium bicarbonate if ordered. So remember, alkalizing the urine reduces precipitation of your myoglobins in your kidneys. So yes. So this is included. Ayan. Next, we have encourage early ambulation and resistance exercise. Remember, there is muscle weakness. There is muscle pain. So what did we say? Avoid. No, assist lang yan. So the answer here is no. And monitor urine output and color closely. What's our answer? Yes. So this is included. So if you're going to take it on ASATA, so the answers are 1, 2, 4, and 6. Did you get it, my dear colleagues? Ayan. Okay. So I hope you are learning from that.
Wow. That's a wow, Miss McLean. It's a very thorough discussion, very impressive, and very NGN type of discussing the rational. This is how things should be done. Okay? Great. A lot of the comments here are saying thank you, and they are so participative. Okay, let's move
thank
on.
you. Yeah, thank you, sir, and the rest of my dear colleagues. So I think everyone is still excited, no? Thank you for staying with us. So don't worry, after me, we
we
have
have
another mentor.
1,800 viewers on
Oh,
Facebook.
really? Oh my God,
And
thank
more than
you.
100 here on YouTube. Thank you for
Wow.
spending your weekend with us.
Yes. Okay, so we are down now down to our last question. So a nurse is teaching a client with chronic pancreatitis. Remember, there are 3 types of your pancreatitis. You have your acute, your chronic, and your drug-induced pancreatitis. So about the correct use of your pancreatic enzyme replacement. So usually, take note, patients with chronic pancreatitis, so remember, they have problems in insulin production and production of your enzymes. So remember, your enzymes are essential for the digestion of your carbohydrates, your fats, proteins, etc. So take note, if they have chronic pancreatitis, so the function of your pancreas to produce the enzymes and your pancreas, particularly your pancreatic enzyme, is impaired. So that's why they are given lifetime pancreatic enzyme, especially if they are going to eat. Okay. So the question is asking, at which of the following times should the nurse instruct the client to take the pancreatic enzyme? Remember, this is a simple question. So, before I give you the correct answer, let me know what is your answer. So remember, please,
I'm
you have
pretty
to
sure they will answer the old concept that we
correct,
learned
sir.
from
Correct.
the false prophets of the NGN on the internet that are teaching obsolete concepts.
Okay. I think, sir, because
Come
of
on, just
your
try, just try.
because of your warning, I think they will not answer. But please try. Let's see. Allah. Okay. So Jurnarlene says 1 and 2. Chris says 2 and 4. Okay. How about the others? Chiradi, Chiraday, 1, 2, 4. Okay. Rowena says 1, 2, 4. Okay. Okay. So I think that's enough. Okay. Let's go over. Okay. Remember, okay, let's go over and answer first. With non-fat meals only. So this is wrong. Let's go upwards. So why? Take note, your pancreatic enzymes, especially, they are needed if you are taking in fats. Okay. So remember your lipase, particularly, no, breakdowns your fats. So this is wrong. Okay. On an empty stomach before bedtime. Gaga. Remember, your enzymes are not effective rather without food. So doing this no defeats the purpose of your pancreatic enzyme. So wrong. Okay. Next, with snacks that contain fat. Remember number 6 with non-fat, so that's somehow contradicting. So this is correct. So with snacks that contain fat, because your pancreatic enzyme contains your lipase or lipid. So this is responsible for the breakdown of your fat. So that is included. Okay. Next, 30 minutes after finishing meal. So remember, 30 minutes is too long. No? It's too long to maximize the effect of your enzyme. So this is wrong. Okay, that's too long. Okay. So let's go over with the first bite of meal. Yes. So remember your old concept? So with each meals and snack. So this is included still. Okay. So now then, do we give it immediately before a meal? What do you think? What do you think? Would you include one or no? Let's see. So April says yes, Asibar yes. So the correct answer is yes. You are correct. Immediately before meal. Why? To make sure that your enzymes are already present in your gut. So by that, they would eventually function as follow. Correct. You are correct. So but before kasi, the old updates would only entail us to with snacks that contain fat or with the first bite of meal or with every or each meal and snack. But right now, the update is we can give it immediately before a meal. So it could either be 5 minutes prior to your meal. So that to make sure that your enzymes are already present at your or in your gut. Okay? So let me
Wow,
know
Miss
your
McLean,
score.
we just hit 2,000 viewers on Facebook.
Yay!
Doing great. Thank you very
Yes.
much for trusting the
So,
Gapuz system, the NGN authority. Let me say that the only next generation Nclex authority in the world with a simulator of the NGN.
okay.
Okay.
So before I pass on the baton to our
Vice
president,
President
so let me
for
know
research.
if from 1 to 5, what's your score? For those people who tried to answer, let me know
Who
what are your
tried to
score.
answer?
Okay, let me know your score. Wow, RL got 3. So Rowena got 4. Oh, wow, that's good. I think this April got 3. Ferlida got
That
3.
means they are a bit updated. But
Yes.
still, the 2 points would have made the difference whether you will
Yes.
pass or fail. They're learning a
Okay.
lot
Thank you,
from the
everyone.
team.
So,
Thank you to our lead 80 Fibers mentor.
thank you, Sir Ray. And on behalf, so thank you, my dear colleagues. So stay still. So we still have one of our best, okay, our VP4 research. So let's welcome our ever-glowing first-time mom, Mentor Che. Mentor Che!
Hello, Sir Ray, Mentor McLean. Thank you so
Hello,
much.
Mentor Che and Mentor McLean. We're joining you tonight. Panggulo lang kami. We're gonna
Wow,
make your
wow.
session a little disorganized with our thoughts. Anyway, okay, take it away, Mentor Che.
Hi, guys. I know after that session, for sure, you you share, my first reaction, when I joined the review for the first time. And this is it. How do I not know this? And if this is your reaction,
Because some people are watching the false prophets of the NGN on the internet that are teaching obsolete concepts or that are
that's
teaching NLE concepts or have yet to pass the NGN and they are teaching. Okay?
that's true, sir. So that's the reason why we know that you are, you're here at the right place. And I hope that, as you're learning, you're also enjoying, the different updates that you're having. And this is all for free. So let me get down to my questions. So these are mostly diagnostic tests. So let's see your knowledge about this. So this is the first question. A nurse is reviewing the ECG of a client who presented with muscle weakness and
I
palpitation.
protest, Ma'am Che. You should have your picture there over mine. Okay.
Okay, sir. The ECG tracing shows tall peak T waves and widened QRS complexes. Which of the following medication should the nurse anticipate administering? Select all that apply. Now, when you're looking into questions such as ECG, most of us are expecting to see the strip. And to be honest with you, sometimes your NGN will include the strip, but sometimes they will just describe what is being seen in the strip. So you should have the knowledge of knowing what to see in the strip and also how it is being described. So based on this, so let's see, guys. Let me use my pen for this part of it. So it says here your manifestation of your client, muscle weakness, palpitations. Now there are, many conditions that can have muscle weakness and palpitation. But when you look at the ECG tracing, it says there tall, picked T waves with widened QRS complexes. So guys, before we answer the question, can you tell me what condition does this ECG tracing alludes to? Anybody? I think some of you know tall peak T waves, very good, is
Let me read
hyperkalemia.
to you, Ma'am Che. Some of them are saying hypokalemia. Some of them are saying
Oh,
hyperkalemia.
so the answer should be hyperkalemia because in
Maybe they
hypo,
get confused with muscle weakness because it's present in both hypo and hyper.
yes, that's why your difference, guys, is that in hypokalemia, usually a prominent U wave or the presence of U wave that is usually larger than your T wave. So if that is the case, presence of U wave plus, you may or may not have this, but T wave inversion signifies hypokalemia. But if they mention tall peaked T waves, that is your hyperkalemia. Is that clear, guys? Okay? So once you have that, so we know now that this is hyperkalemia. Which of the following medication should the nurse anticipate administering? Okay. So you have here several medication. Please tell me, should I give calcium gluconate? Yes or no? On the chat box, please. Calcium gluconate. Very good. The correct answer is yes. Why? Why should I give calcium gluconate to a patient with hyperkalemia? You know that one of the things that your potassium damages is your heart. And your calcium gluconate will serve as an emergency treatment to prevent the potassium from destroying the heart. So this is now a yes. So this is your first line emergency measure. Emergency drug. What about kayexalate or sodium polystyrene sulfonate? Kayexalate. You know that this is a potassium binder, so it is a yes. Okay. Now, kayexalate binds with potassium and removes it out of the system in a slower pace than calcium gluconate protecting the heart. So that's the reason why we give this IV because it's kind of faster as a cardiac defender. Okay, and then you have their kayexalate. Now, what about number 3, regular insulin with dextrose? So you know your sodium potassium channels, so it's a yes. Now the idea here is your pathophysiology, that when insulin is there, insulin helps the potassium to enter the cells, right? And because you're using insulin, sugar also enters the cells. So to prevent you from having hypoglycemia, we give it with dextrose. Okay? So yes. What about number 4? Spironolactone. What do you know of spironolactone? What is its drug classification? It is a potassium-sparing diuretic. Should we spare potassium if we have a lot of it already? What do you think, guys? Potassium-sparing diuretic? It's a no. So number 4, no. What about number 5? Furosemide Lasix. Guys, you know that when you urinate, potassium is excreted out, right? So giving your loop diuretic will enhance excretion of your potassium through the urine. Therefore, 5 is a yes. And number 6, sodium bicarbonate. What do you think about this? Ooh, I love it. What do you think, guys? With sodium bicarbonate, is it a yes or a no? Now, usually, guys, yeah, it's a yes. It will be helpful, most especially if you have a client who has metabolic acidosis together with their hyperkalemia. So for acidotic clients, we also give your sodium bicarbonate. Now, what do you think, guys? Is this helpful? So if you are not able to get to understand the diagnosis that this ECG strip is hyperkalemia, then how will you be able to include the correct medications? So it's important for you to first look at the symptoms, look at the description of your ECG, determine what it is, and then eventually know which drugs are needed. Okay? So, yay! Good job to those who answered correctly. Let me go to the next one. For the next diagnostic test, I think this is maternity. There we go. A nurse is reviewing the fetal heart monitor tracing of a client in active labor. The strip shows abrupt drops in fetal heart rate unrelated to contraction. Ooh. What kind? So you see the word here, drops. So it's a kind of deceleration. Right? There you go. Right, Camille? Now, the question is, but it says here the fetal rate drops are unrelated to contraction. So they didn't say it happens early in the contraction. They didn't mention it happens late in the contraction. They mentioned it's unrelated to contractions. What type of deceleration are this? What type of deceleration is this, guys? Your answer will be variable. Very good. And if you recall, guys, listen, if you recall our different deceleration and your fetal heart rate as compared as it relates to contraction, remember your mnemonic veal chop. Yes, Camille recalls it. So you have variable, right? Deceleration. You have your E, early deceleration. You have your A, acceleration. You have your L, late deceleration. So, and you have your chop as the, what it meant, okay? So, variable deceleration is usually associated with cord compression, okay? Early deceleration, H, head compression. Acceleration, this is normal, right? So, oxygen adequacy, meaning it's good, it's okay. Some has okay here, so it's also okay. Late deceleration means P, placental insufficiency. So class, the key is that first identify what deceleration or acceleration it is. So as you can see, it's a drop, so it's a deceleration. It's unrelated to contraction, so it's variable. If they mention it happens early in the contraction, then it's head compression. If it happens with acceleration, that's that usually happens, that's normal. So accelerations are normal. Late deceleration meant that after the peak of contraction, that's the time that the fetal heart rate decreases, which means that there is a deficiency in the blood flow coming to the patient or to the fetus after your contractions. Okay, so that's late deceleration. That's why it's placental insufficiency. Now, with that in mind, look at this keyword, cord compression. Okay, which then will be the reason for this variable deceleration. Select all that apply. Pile, select all that apply. With the keyword cord, give me your numbers, please. It's a SATA question. It's a SATA. Select all that apply. Saan dyan yung may indication that it's cord compression? Cord compression. Ooh. Come on, keep it coming. Cord compression, nandyan na, guys. Baka naman. Okay. 1. Some of you says 1. Correct. Umbilical cord compression. Andun na, di ba? Okay. Guys, listen. And this is usually what people miss. Why is the cord compressed? What is the reason why it's compressed? So it could probably mean that the cord compression arose from decrease in your amniotic fluid. Guys, usually this is missed. If your amniotic fluid volume is low, okay, what happens? And the child moves about. So there is a tendency that the umbilical cord then will be compressed. Do you get it? And they miss this. Of course, you get nuchal cord. Of course, you get cord prolapse, right? But oligohydramnios, they miss it just because it doesn't say cord. But if you think about it, if my fluids are down, if the amniotic fluids are down, then there's a tendency that when the child changes position, the baby changes position, the cord will be compressed. So your correct answer includes 2. Now, what about 3? Uteroplacental insufficiency. It's there. It's late deceleration, so that's a no. Okay, that's late deceleration. Nuchal cord. There's that cord. So, yes, it should be included. Maternal hypotension. Question. When you say hypotension, what does it involve? Hypotension, does it involve blood supply? So when you say blood supply problems, what to what deceleration is it usually associated with? Lack of blood supply, because the mother is hypotensive, so there is lack of blood going to the baby. What is that? Tell me on the chat box, is it variable, early, late? Yes, it's late deceleration. Though they didn't mention uteroplacental insufficiency, but when you say uteroplacental insufficiency, it means that there's lack of blood, oxygenated blood going to the baby. Therefore, maternal hypotension leads to that. So this is late deceleration. So you will not choose this. Okay, it's not variable. So what about cord prolapse? There's the word cord. It's a yes. So the correct answer here, guys, 1, 2, 4, 6. So please do not forget oligohydramnios. Okay? So good, good, good. Okay, moving to the next question. You still good, guys? Learning? Okay, that's great. Here it is. A nurse is preparing a client for a scheduled transesophageal echocardiography, or TEE. From the word itself, it's possible that you're not familiar because it might not be practiced in the hospitals that you've rotated in your practice, but transesophageal echocardiography is better than your regular echocardiogram, because it is, in the flexible tube is inserted in your esophagus, and because the heart, so you have your esophagus, it's right next to the heart, right? So the visualization is clearer here. So the question is, which of the following laboratory results should the nurse review prior to the procedure? Select all that apply. So I want you to think about the procedure. It's TEE, guys, transesophageal echocardiography. So here, I'm gonna use just a picture, especially for those who have yet to see this. So this is your transesophageal echocardiogram. As you can see, there is that transducer, TEE transducer that they introduce into the esophagus. Okay, so just imagine what is required. So to give you just a mnemonic on, which are important to recall, I'm going to give you the mnemonic safety, but the word, the letters are T, E, E instead of safety, TY. So safety, the first important thing is safety, of course. So with safety, post-op, the patient should be side lying to prevent your aspiration. And do not forget to remove dentures. Okay, so these are quite important. Next, assessment. What do I assess? You assess for baseline data. Which baseline data are important? Vital signs are important. Important is for you to know your bleeding tendencies. Why? Look at this. You are inserting this tube into the esophagus, guys. Medyo parang papasok dito yung deep throat. More than
is there an effect? For example, if the patient's taking an anticoagulant, do they have to stop it?
Yes, sir. So those are those medications that can cause bleeding will be withheld. Okay? Kasi ayaw natin, we don't want our clients to bleed out during or post-procedure. Okay? So that's why part of your assessment post-op will be to check for hemoptysis. Okay? So there you go. Next, you have, aside from your baseline data, of course, you have to check O2 levels. Okay, these are part of your assessment. Okay. Next, because this would require sedation, you should fast. Okay. Make sure there is fasting. 6 to 8 hours is your recommendation for fasting. Because it's an invasive procedure, as a nurse, you have to ensure that consent was signed. You will not be the one to sign, to describe the procedure to your client, but it will be the doctor who will perform this. but it's your responsibility to check that the consent was actually signed prior to this. Next is to check for throat pain after. O, diba? As you can see, if you go for deep throat, there could be throat pain. So what do we do with throat pain? Mama claims expertise, Char. So
Believe
what do we
the
do?
baby that's causing the ectopic pregnancy.
Esophageal pregnancy. So throat pain, guys, we do give your saline gargles after. Okay, if there is any pain, or you can give lozenges. Yeah. So for the pain. Then of course one important thing to as preparation is to make sure that there are emergency equipment bedside just in case. Okay, emergency equipment bedside just in case there is airway obstruction afterwards because of, let's say, throat edema. So what you do is you have your O2, your suction there. That's important. And lastly, aside from your emergency equipment, make sure that the gag reflex has returned. So that's part of your education. Usually they use here your lidocaine spray or to suppress the gag. So educate your patient that to wait for gag to return before oralizing. Char.
Wow, that's an excellent acrostic. Safety, I love it.
Yes, sir.
Mentor Che, there are modifications of your TEE. Some would usually use a contrast medium, in which case I just have a tip for those who are about to take the test. Whenever a procedure, like for example, if the doctor opts to use a contrast medium for TEE to enhance the visualization of the blood vessels and the heart, it's very important to assess if the patient's taking metformin, because if metformin combines with the dye, it causes lactic acidosis that's very harmful to the kidneys, and this could potentially lead to acute kidney injury. So that's an important thing to note if your patient is a diabetic and the doctor opts to use contrast medium before for the TEE. Okay, so thank you.
Wow, thank you so much, Doc, for that update. In addition to that deep dive on TEE. So with that in mind, guys, which of the following lab results should you review prior to your procedure? Please tell me on the chat box the numbers that you will choose here. Is it 1, 2, 3, 4, 5, 6? Which will you answer? Camille has an answer. I love it. What about the others? Come on. Come on. Come on. Doc, everybody says 3, 4, 5, 6. And that is the correct answer. Yay! Good job, guys! Because of, why do we check PT, prothrombin time, hemoglobin hematocrit, INR, platelet count? These are all indication of possible bleeding. BUN electrolytes, there's no contrast medium, as as was stated, if it's the regular TEE, so you don't need to check the BUN. Electrolytes, well, potassium and sodium, this is not affected by your TEE. But the bleeding is your highlight. So there you go. Guys, are you learning? Good job, everybody. So we go to our next one. This is all about MAN2 test, your tuberculin test. Okay, tuberculin skin test. So a nurse is interpreting the results of a MAN2 tuberculin skin test administered to a client who is HIV positive. Okay, there you go. The client has an 18 millimeter area of erythema and 5 millimeter of firm, raised, and thickened part at the injection site after 48 hours. Which of the following best describes the nurse's interpretation of the test? Before I answer, can you tell me your answer here? Is it negative, positive, inconclusive, or negative because the duration should be at least 10 millimeters?
I think, Mentor Che, there's one phrase that's confusing them. There's there's a phrase there that says 18 millimeter area of erythema, meaning area of redness. Now the question now
Yes.
is, when we're trying to interpret TST, do we really need to include in the measurement the area of erythema or redness, or just the area
Induration.
where you have an induration, or described as a firm, raised, and thickened part at the injection site? Okay, so a lot of them is getting confused now.
So, guys, 5 millimeters of firm, raised, and thickened part is what you're looking at here. So, the induration is what matters. Not the redness around it, but the induration. So, now, what will be the correct answer? So, we got confused. So, the correct answer, guys, is 2. This is a positive result because the induration of more than 5 millimeter is considered positive for clients with HIV, which is actually lesser than regular clients, right? So, do you still recall? So, some of you are confused, must be read at 72 hours. No? So, we have 48 to 72 hours. That's the window. But, at 48 hours, you can read the Manto test already, the results already. Okay? So actually, the problem is if it is more than 72 hours. So that will prove to be a problematic. Okay, so how does it compare? So we've mentioned this is in comparison with HIV positive clients. Why does a 5 millimeter induration a confirmation of or a positive result? So you know the pathophysiology of HIV positive clients, right? You know the major problem. The major problem is that their immune response is depressed. And with a depressed immune response, there's a possibility that it will not react. Although they're positive, they have the bacteria, they might not react with the skin test because they're immunocompromised, meaning their immune system is not reacting well. So that's why a 5 millimeter induration is already considered positive. Okay, so normally if you're a health worker with moderate risk, so 10 millimeters, right, is considered an induration for healthcare workers. So this one, okay, induration must be at least 10 millimeter. So this is positive for healthcare workers or those with moderate risk, those who are exposed to it. So for example, this is Nclex based. So if you're an immigrant, so let's say for example, you're coming from the Philippines and you're going to the US. So a 10 millimeter induration is considered positive already. But for low risk individuals, 15 millimeters induration is your positive. So this is for low risk. So it requires like a 15 millimeter induration for low risk. So moderate risk, that's 10 millimeters. Healthcare workers are included there. So, but as I've mentioned, for HIV positive, so we want to, they are kind of less reactive because of their immune compromisation. So a 5 millimeter or more is considered already positive. Got it, guys? So I think many of you got 2. Got the 2 as the answer. So we're down to our last one. So this is it. It's amniocentesis. A pregnant client is scheduled for an amniocentesis at 18 weeks gestation. She asked the nurse how the specimen will be collected. Which of the following responses best describes how the specimen is obtained? What will be your answer here? So it's just the procedure, how it will be obtained. Amniocentesis. Is it a catheter inserted through the cervix using ultrasound guidance? That's your chorionic villus sampling. So 1 is out. Is it a needle inserted into the amniotic sac via the abdominal wall using ultrasound guidance? Yes. So that is your correct answer. What about 3? A swab. Oh, there you go. Swab is to collect fluids. What's that? Swab collecting fluids in the vaginal fornix. So that's not amniotic fluid. That's cervical specimen or vaginal specimen. What about 4? Laparoscopic. No. So that's, this is not used in standard amniocentesis. So, well, yeah. So this is not your answer as well. Now, what is the purpose of your amniocentesis? Let me just give you a mnemonic for this. I'm gonna give you amnio. Let me find where to write this one. Amnio. So letter A, one major purpose is to check for abnormalities, be it genetic or chromosomal. Purpose of your chromosomal. Letter M. Aside from your abnormalities, we look for maternal and fetal incompatibility. Example of that is your RH, incompatibility. So you can check that using your amniocentesis. Another one, letter N. So I'm gonna write here because this is where the NTDs. So neural tube defects, screening. So remember your meningocele, anencephaly. Okay, so this is another one of a perfect purpose. Letter I is infection diagnosis. Sorry if my table is moving when I write, so the screen is also moving. And lastly is organ maturity check. So another purpose is to check, especially fetal lung maturity. So that these are the purpose of your amniocentesis. So you have the mnemonic amnio. There you go.
That's a wow, Mentor Che. We've just reached 2,500 viewers on
Wow.
Facebook. A lot of people are viewing. That's a reflection of the trust they have in the system. And your advice, Mentor Che.
Thank you, Doc. There you go, guys. So I hope that you've learned from that part of your diagnostics.
So can we also have some few words from Mentor McLean, your advice to those who are taking the test anytime soon, within the week or within the month or so?
Ay, ako na ba? Ay, sino na yung tong... Okay.
Yes, your advice.
Okay. Sino ba tong naka... Okay. So for those who will be taking their exam for this coming month, for a couple of months from now, so always believe that you need to equip yourself with a system that works. And I always make sure to advise them that they have to be ready and they have to be, like what you said earlier on, sir, they have to stay updated because there are times that the Nclex will definitely play your mind as well. So what you know from 3 years back, from what you know this day on. Okay, that's my advice.
So what matters the most is be updated and
Yes.
get yourself into a system that works. I love that. So please feel free. I think the 85ers would also have their next free NGN soon. That's live. Now, the good thing about the 85ers is that you are given the opportunity to use our simulator, right?
Yes, definitely,
And that's
sir.
at the
Yes.
second floor of the Ray A. Gapuz System building in UN Avenue, the only NGN simulator in the world that works. And a lot of people are saying those tests in there those tests are really life-changing. Okay, so thank you for all of you who opted to spend their weekends with us. On behalf of Mentor Che and Mentor McLean, this is your mentor, your fact check buddy Ray Gapuz, sa ngalan ng nagsasabi ng totoo. Serbisyong totoo. Walang kinikilingan. Eh, ganon.
24
Walang
oras.
pinoprotekta.
Bandila.
Lang tayo sa sama-sama natin pagiging
Saksi.
witness. Ganon.
Sexy.
Ayan po, nababaliw na naman kami. Good luck, everyone. God bless you all. And thank you very much for joining us. See you in our next updates class, only here at the Ray Gapuz Review System with the 85ers lead mentor and our Vice President for Research and Program Development, Our wish is for you to shut down at 85.
85.
Keep believing that you can, and we know you will. Take care. Have a pleasant evening. Happy weekend. And to all of you who are joining us from any part of the world, thank you so much. See you and take care.
Bye, everyone.
Bye, everyone.